Hello everyone, and welcome to our discussion on a medication known as Kesimpta, which is the brand name for the generic drug ofatumumab. This session is designed for educational purposes, and while we strive to provide accurate and up-to-date information, we encourage you to consult with a healthcare professional for any medical advice or concerns. Description: Ofatumumab, marketed under the brand name Kesimpta, is a subcutaneous injection used primarily for the treatment of multiple sclerosis, MS, specifically relapsing forms, including clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease in adults. Approved by the FDA in August 2020, Kesimpta is a monoclonal antibody that targets CD20, a protein found on the surface of B cells, a type of white blood cell. By binding to CD20, ofatumumab helps reduce the number of B cells, which are believed to play a key role in the nerve damage associated with MS. This reduction can lead to fewer MS relapses and may slow the disease's progression. Warnings: Patients should be aware that Kesimpta can increase the risk of infections due to its immunosuppressive effects. It is not suitable for individuals with active infections. Before starting treatment, it is crucial to check for hepatitis B, as reactivation can occur in patients who carry the virus. Regular monitoring for signs of infection is recommended throughout the treatment. Before taking this medicine. Before starting Kesimpta, inform your healthcare provider about your medical history, particularly if you have had any recent infections or if you have been treated for hepatitis B. It's also essential to discuss your current medications, as Kesimpta can interact with other drugs that affect the immune system. Patients planning to receive vaccines should consult their doctor, as live vaccines are contraindicated during and after treatment with Kesimpta until immune function is restored. Side effects: Common side effects of Kesimpta include injection site reactions, such as redness, pain, or swelling, upper respiratory tract infections, and headache. More serious side effects can include increased risk of infections, hepatitis B reactivation, and progressive multifocal leukoencephalopathy, PML, a rare but serious brain infection. If you experience any new or worsening symptoms, such as fever, night sweats, or flu-like symptoms, contact your healthcare provider immediately. Interactions: Kesimpta can interact with other medications, particularly those that affect the immune system or vaccines. It is important to inform your doctor about all medications and supplements you are taking to avoid potential interactions. Dosage: The recommended dose of Kesimpta is 20 mg administered by subcutaneous injection. The initial doses are given at weeks 0, 1, and 2, followed by monthly injections starting from week 4. Always follow your healthcare provider's instructions when administering Kesimpta to ensure its effectiveness and safety. Patients should avoid receiving live or live-attenuated vaccines while on Kesimpta and until their immune system has recovered, as discussed with a healthcare provider. Avoiding exposure to infectious agents is also advised due to the increased risk of infections. FAQ: A common question about Kesimpta concerns its safety and efficacy for children. Currently, Kesimpta is not approved for use in individuals under the age of 18. Further studies are needed to establish its safety and effectiveness in this age group. Closing. Thank you for joining us to learn more about Kesimpta. This overview is meant to inform and should not replace direct medical advice from your healthcare provider. If you have any questions or concerns about using Kesimpta, please consult a medical professional. Thank you for tuning in, and take care.